Hi, in this video, I'm going to be talking about BRCA1 and BRCA2 genes and breast cancer. What are BRCA1 and 2? How do we find out if you have them? And how do we treat breast cancer associated with BRCA1 and 2? Before I go on, I'd love to have you subscribe to our channel. We put out content 3 times a week, so there's always new information. So BRCA1 and BRCA2 are genes, and you may hear them called BRCA1 and BRCA2, and I'm actually going to call them that for the sake of time. It's just easier to say. So BRCA1 and BRCA2 are two different genes. We inherit a copy of BRCA1 and a copy of BRCA2 from each of our parents. So from our mother, we get a copy of BRCA1, and from our father, we get a copy of BRCA1. From our mother and father, we get a copy each of BRCA2. When you have these BRCA genes, what these genes are is tumor suppressor genes, and they keep cells that might get errors when they're dividing in the DNA, the genetic makeup. They suppress those tumors from continuing to grow. If you have a mutation in BRCA1 or BRCA2, it means this tumor suppression function of the gene is not working. These are very big genes, so there are many, many different mutations that can be seen in both BRCA1 and BRCA2 genes. If you have a parent with a BRCA1 or BRCA2 gene mutation, an abnormality in that tumor suppressor gene, you have an increased risk of breast, ovarian, pancreas, and prostate cancers in particular. So how do you know if you have a BRCA mutation? We will recommend testing for a BRCA mutation in people who are at higher likelihood of having a BRCA mutation, an inherited susceptibility related to BRCA1 or BRCA2 under certain circumstances. There are some people with no family history in whom we recommend testing, and those are people who are diagnosed with breast cancer at a young age, people who have bilateral breast cancer, people who have breast cancer in one breast and then the other. So you can be diagnosed with breast cancer in both breasts at the same time, or first one and then the other. People whose breast cancers are triple negative, that is negative for the estrogen receptor, progesterone receptor, and the HER2 oncogene or oncoprotein. So triple negative breast cancers we see more commonly in people with BRCA mutations. So the tumor features alone may encourage us to offer you genetic testing. This is done not on the tumor itself, but it's generally done on a cheek swab or a tube of blood. And you will often see a genetic counselor first to understand, why are you being tested? What would the test results mean if they're negative or positive? And you may also get tested first and then see a genetic counselor. There's a shortage of genetic counselors, and sometimes we just want to keep the testing moving, and we'll give you the counseling thereafter. So it all depends on the concentration of genetic counselors in your area. If you are advised to get testing, we will test a cheek swab or your bloodstream, and we will identify whether or not there's a mutation in BRCA1 or BRCA2. Let me turn next to some other types of people in whom we would recommend genetic counseling and perhaps testing. People who are of Ashkenazi Jewish descent are more likely to have a mutation in one of the two BRCA genes. People whose tumors are triple negative, as I mentioned, are more likely. People who have a strong family history of a breast, ovarian, pancreas, or prostate cancer are more likely to have a BRCA mutation in their family. People who have somebody in the family diagnosed with multiple cancers, so breast and ovarian cancer, or somebody with ovarian and pancreas cancer, all of these will raise for us the possibility of doing genetic testing with or without counseling, depending on the order in which you get counseling. We usually do offer counseling along with the testing. We don't recommend testing alone, but that you talk to a counselor about what does it mean to have it and what does it mean not to have it. So I've covered what BRCA is, the fact that we inherit one gene from each of our parents, that a mutation in the BRCA gene increases the risk of breast and ovarian, as well as other cancers, that we can test for a gene. We can test even before somebody is diagnosed with cancer and then do preventative measures. And we can test after you've been diagnosed. If you carry a BRCA gene, each of your children has a 50-50 chance of having inherited a BRCA gene mutation, I should say. We all have BRCA genes. If you've inherited a mutation, each child has a 50-50 chance. And not only can your children be tested, but if your parents are not known to have an inherited susceptibility and your siblings haven't been tested, this is something that you will work with your medical team to identify who should be tested next. So would we treat cancer differently if we found that you had a BRCA mutation? Now, there are other inherited genes that increase the risk of breast cancer. We're focusing on BRCA1 and BRCA2, but check out our other videos on genetic testing for breast cancer and on Li-Fraumeni syndrome as well. So if you are found to have a breast cancer associated with an inherited mutation or even a spontaneous mutation, which is much less common in BRCA1 or BRCA2, we can offer the PARP inhibitors. The PARP inhibitors are drugs that inhibit the abnormal protein that's generated by a mutated BRCA gene. So, and these have been shown to be effective in metastatic advanced disease that's spread to other parts of the body, and to be effective in high-risk people who've completed all of their other therapy. The PARP inhibitors are one of the major advances in breast and other cancers. And we are so excited to have them. They're taken as a pill, so it doesn't mean continuing to go into the treatment center. And yes, of course, they have side effects, which I won't go into now. We have other videos about the PARP inhibitors, but PARP inhibitors are being offered, which is a relatively new treatment that a lot of physicians who don't specialize in oncology may not know about. The other treatment implication for you would be the type of surgery you have. If you have an inherited mutation in BRCA1 or BRCA2, it does not mean you have to have a mastectomy. It does not mean you have to have a bilateral mastectomy, but you may choose to, because having a BRCA mutation increases your risk of a cancer in not just one breast, but in the other. And a lot of people, knowing they're at elevated risk, would like to have bilateral surgery to decrease as much as possible their risk of developing a cancer in the other breast. You can also, if you have an inherited BRCA mutation, you can also have a prophylactic mastectomy. So we don't generally recommend that people have their breasts removed to prevent breast cancer. Exceptions are inherited susceptibilities like mutations in BRCA1 and BRCA2. The other thing that may be offered to you is prophylactic removal of the ovaries. And this can decrease your risk. It's actually more common now that we are having the surgeons remove the fallopian tubes, which is where most ovarian cancer actually starts. So some people, depending on what your medical team is doing, can keep the ovaries and have the fallopian tubes alone removed until the end of your menstrual life, till you turn, till you're in your mid 40s or 50s, at which point you may wish to have the ovaries removed, but you may find that you can have just the fallopian tubes removed and markedly decrease your risk of developing what we call ovarian cancer, but that doesn't actually most of the time start in the ovaries. This is something also that's become clearer and clearer over the last 5 years or so. So some newer thinking about where ovarian cancer arises. We do not recommend removal of the pancreas. We can't do very well without our pancreas, but there are families where there's a very high risk of pancreas cancer who have a BRCA1 or BRCA2 mutation, where we are doing screening for early detection of pancreas cancer. Normally, pancreas cancer is not a cancer we screen for. the exceptions being in people with BRCA1 or BRCA2 mutations and a family history of pancreas cancer. I've covered a lot in this video. We've talked about what BRCA genes are and how do you get them and what do they mean and what should we do about them and why should you care? I hope it's been helpful. If it has, click like. That helps other people just like you find this video. Subscribing will help you see more of our videos, and you can drop a comment or question below. Share your experience with the Yerba community, and although we can't answer specific questions, we can provide general responses to your questions, and we try to get back to you within 1 to 2 weeks. Thanks as always for watching.